My name is Dr. George E. MacKinnon. I'm founding dean of the College of Pharmacy at Roosevelt University. I'm also vice provost for health sciences and a board member of Formulary. Well, formulary readers, I am sure, are very interested in the optimal outcomes of medication therapies. And the journal provides that type of cutting-edge information specific to new and novel therapies. Pharmaceuticals are by far the number one intervention used in healthcare, and pharmacists are that healthcare provider involved in making sure patients are receiving optimal outcomes of that therapy they've been prescribed. Unfortunately, at the federal level and at many state levels, we are not recognized as healthcare providers under the Social Security Act, 1861. Well, pharmacists are part of the healthcare team, and if we do not recognize pharmacists as healthcare providers, albeit there's challenges to maybe how we feel with our healthcare team members, but the reality is we really are more concerned about the ill outcomes that could occur with our patients. And if we are not able to have access to healthcare information, transmit that information, health information technology, through electronic medical records, because we're not recognized as healthcare providers, that will in fact challenge providers, pharmacists as well, in sharing information. Along those lines, we've had both legislative and policy over the years that have recognized pharmacists as healthcare providers, from Medicare, from the Department of Health and Human Services, but we have not been officially recognized as healthcare providers, even though we as pharmacists have a national provider identification number. For 30 years plus, organizations such as the VA and Indian Health Services have had very progressive pharmacy services where pharmacists have been recognized as primary care providers in a credentialing mechanism that equates them essentially with physician assistants and nurse practitioners. So there are challenges clearly at federal and state level, and some states like the state of Washington, the Attorney General has looked into this very issue and has deemed that pharmacists are in fact healthcare providers and practice within their scope as such. Well, I think the pharmacy profession, through associations and active practitioners, have recognized that legislation and the appropriate process for that, for recognizing pharmacists as healthcare providers, is important. At this point in time, there is no active legislation at the federal level that is moving through Congress. But part of that is a challenge because of congressional members are not even aware in many districts that pharmacists are not recognized as healthcare providers. And I had a similar conversation with a federal representative that did not recognize that. So it's very difficult for them to understand, even though they've always thought of their pharmacist as a healthcare provider and practitioner available to them, very conveniently located, frankly, in many of our corners across the country.